This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today we are joined by Pam Bartha of Live Disease Free. Thank you for joining us today, Pam.
Thank you so much, Dr. Joe, for having me.
Of course. So I am really excited to talk to you. We were talking a little bit before we started recording about what this topic or about what we're going to cover today, and I think our audience is really going to be excited by the end of this and feel really encouraged by what it is that you and your team are doing and just the hope that you're providing for people struggling with neurological conditions, especially MS. So before we get too deep into it, though, would you mind just kind of giving our audience a little background information on yourself and your journey to this point?
I would love to. So I was a healthy 28-year-old one day, and then the next day I literally started to lose vision in my left eye, and my eye went completely, like with a complete patch over my eye within 3 days. And so I saw an eye specialist quickly. I was quickly referred to an MS University Hospital clinic in Canada. It's one of the best. And they diagnosed me with multiple sclerosis. And looking back, I had a couple of other warning signs, tingling, etc. But from that point on, seeing the experts there, being healthy all my life, like I really thought that they were going to fix me. And I got this diagnosis at the age of 28 years old that I had multiple sclerosis and that there were no cures, that I would end up being disabled in time, that there was nothing that I could do, that people would tell me about all kinds of snake oil cures. But as the experts, they told me that I would be completely disabled. And I was devastated. I thought my life was over. Shortly after that, my mother-in-law gave me a book on integrative health, which I didn't know anything about. This was like 1988. And that started my journey on a different path. This medical doctor wrote a book, The Yeast Connection by Dr. William Crook back in the 80s, about how these infections in the body were causing disease, multiple sclerosis and other diseases. And he really focused a lot on candida. And so I found 3 other medical doctors that wrote books similar to talking about candida. And so I decided to take a different path at that point. So long story short, it's been over 35 years that I've been able to live multiple sclerosis free, like free of MS, live a full active life with no MS medications. And I had another child too, which is amazing because after my second child, 6 months after him, that's when I had my first MS attack. So I learned a lot over the last 35 years, and I'm so grateful to raise my family and to be a partner with my husband. But I've had the amazing privilege to coach thousands of people all over the world. I'm an educator. I went back to school. I got a science degree. I became a teacher. And so that's what I do is I teach people how to play that active role in their healthcare, to take charge of their health, to work as partners with their healthcare professionals so that they can really reach their health goals. And what we have really discovered is that, back in the 80s, they talked about candida a lot. And then we learned about the vector-borne infections that cause Lyme disease. But more recently, I would say in the last 5 to 7 years, we've discovered that when we're really, really sick, we have these neurodegenerative diseases. We're in a state of dysbiosis, meaning that our microbiome is severely out of balance. And that we have not just fungi out of balance and not just bacteria and possibly active viruses, but we also have protists, which are single cell parasites, and we also have all kinds of worms, roundworms, large and small, and flukes, which I didn't learn a lot about flukes in university, and then also tapeworms. And so I have a science degree and I love researching. And Dr. Alan McDonald is a pathologist in the United States, and he discovered small filarial worms in the central nervous system of every MS subject that he tested. And so these are like specimens from brain banks. So these were people that had multiple sclerosis and they died. So these are confirmed cases, and they just kept the remains and for research purposes. So he discovered these small roundworms. And the significance of that is that veterinarians have known for 100 years plus that when these small roundworms enter the central nervous system of domestic animals, they cause all the symptoms of multiple sclerosis and other neurological diseases. He also found tapeworm larval cysts, or I should say developing tapeworms, so tapeworm larva. I don't know if it was the cyst form or just the small larva. And that would be like neurocysticercosis, where the immature form of the tapeworm move into different organs and into the central nervous system. He also found developing tapeworms in a couple of the subjects, and that's pretty significant. So he was really the first to identify living parasitic worms in the central nervous system of MS patients. We know that there's over 100 years of research linking MS to a spirochete, like a Borrelia, which is the bacteria that causes Lyme disease. There are many, many studies. I've got all of this research on our website, livediseasefree.com. And you can look in the main menu and you can look at there's links to the studies and abstracts. And then also the Candida link that has been definitely documented in the research, where they're finding Candida in the central nervous system, even in the nucleus of brain cells. So all of this research is out there. And I would say that the most recent exciting research that we've come across is that there is a mountain of evidence that people that have multiple sclerosis, that they're always saying that it's a cell mediated and your immune system is fighting something, right? And they think that your immune system is just fighting your nervous system, and they don't know why. And so they've tried to call it an autoimmune disease, but they don't really have the evidence to call it an autoimmune. They need an autoantigen, and they haven't really isolated that. But there is this huge amount of evidence that shows that MS is more of a vascular disease, and where people that have MS, we have all kinds of issues with our red blood cells, with our platelets, with inflammation, like narrowing of the veins. You may have heard, some of your listeners may have heard of CCSVI, and the narrowing of the veins, and they have to do that procedure. And so that is really significant, because we've also discovered that there's over 100 years of research, at least 75 studies linking multiple sclerosis to a malaria babesia type protist. And for a lot of us, that's really significant, because in the center of every at the center of every lesion, there is a vein, a very small capillary. So, and those are the lesions in the central nervous system, and that's how they diagnose multiple sclerosis. And so in the late 1800s, in the early 1900s, there was an outbreak of malaria in the United States, and they treated people with quinine. And the people that had multiple sclerosis that were treated with quinine had incredibly significant improvements in their health. Some of them became MS-free. And so this really triggered some of the practitioners at that time to start treating MS patients with malaria drugs. And it's just truly amazing the recoveries that some of these people had. And so malaria or babesia, those are protists that will infect your red blood cells, and then they make your red blood cells sticky and they clump together, and then you can get obstructions, you can get narrowing of veins, and that would really account for all of the vascular issues that we're seeing with MS. Because I'm all about the root cause. I'm all about we don't want to just take a medication to manage our platelets or our red blood cells. We want to figure out why is our body not working the way it should. And so there's this huge link. I'm not going to go into all the research, but it's so profound and it's so big. And then it really begs the question, like we have the McDonald 2017 criteria on how we diagnose and treat multiple sclerosis. That is the expert panel, the standard of care, pretty much globally.
Hmm.
And they are not interested in any of this research. And I'm
Yeah.
just like, why? Like, why are we stuck in this paradigm of just, suppressing the immune system, assuming the immune system is the problem? When you have all of this other evidence, why aren't we talking about curing people anymore? Why are we just
Yeah.
talking about managing disease? And those of us that are sick, we want our life back. So
Hmm.
we've taken all of this information, all of this research. I've studied under amazing doctors, practitioners, and we've learned. And so because of my teaching background, I put together a course. It's called the Live Disease Free Program. And
Hmm.
it really takes people step by step, getting ready to treat and how to treat. And what we have discovered is that we're in a state of dysbiosis, so we do have to treat multiple pathogens, multiple parasites, like big and
Hmm.
small. We start with big and we work down to small, and we work in a very systematic way. It's really important to support the body through making sure that we know in science that parasites, their favorite source of energy is carbohydrates. And so that's why a low carb diet is really helpful. It makes them less active. We
Hmm.
have less inflammation. We start feeling a lot better. Our immune system, we take some of the pressure off the immune system, and it's a natural way to modulate the immune system. And then we make sure we're having daily bowel movements and sleeping well. And so we're feeling a lot better before we start treating.
Hmm.
And then when we start treating, we get energy tested because we don't have good tests at this time
Hmm.
to determine which parasites we have. So instead of trying to figure out what parasite we have, we're saying which treatments are testing well for us. And
Hmm.
energy testing is not an exact science, but it is really helpful. It's a piece of information that we use, especially if it's a practitioner that is using this in their practice every day and they're very skilled at it and they've got a good reputation. And
And
so then we go ahead.
I was gonna say, can you define what that is? Mhm.
So some practitioners, so it's a chiropractor or a naturopathic physician, sometimes functional medicine doctors now are training in this, and nurse practitioners are starting to pick this up.
Hmm.
And every living plant, animal has an energy field around them. And so when we have infections or a lot of toxicity, it affects our energy field. I'm just going to keep it really simple. And so
Hmm.
when you bring the right remedies into your energy field, it can either balance you or strengthen your energy field, or doesn't make any difference, or can make you worse. And so they can pick up this subtle change either through an advanced muscle testing, or they can pick it up through, they use machines. So there's an AMA machine, there's a EAV machine, there's Vega machine. So there's energy machines that can pick up the subtle changes in energy, or like Dr. Klinghardt has devised ART, which is autonomic response testing. And there's also applied kinesiology. So there's all of these different forms of energy testing. And again, it's one piece of information. It's not
Hmm.
going to be the exact, but it's really helpful instead of just complete trial and error. And so the way that we determine the treatment plan is looking at the student's health history, the
Hmm.
health history of their parents, any specific diagnoses that they've had. And also we have a very extensive infection survey. So there are, specific symptoms that are more specific to Lyme disease or candida or fungus, or the cerebral spinal nematoidiasis, where these little worms get in the central nervous system, or different types of worms, etc. So we look at all of that, and we look at their energy testing results, and that really helps us to determine, to help them to work with their practitioner to decide, what are going to be the best treatments. We use a combination of, which has been the most helpful, is the parasite drugs, and also herbs, antimicrobial herbs, and an oxygen type therapy.
Hmm.
And so there are several different oxygen therapies. There's one that I can't really talk about publicly, but it's just the most cost effective, the simplest. People can use it at home. So they can find out more about the name of that on our website. If you look up, or even if you just Google, oxygen therapies and treating parasites, live disease free, you'll find that. but
Okay.
it's very safe, and it's something that the students can use at home, as long as they're using it properly. And we always advise to work with a practitioner or to work with us. We help them to use all of that and just to play an active role. But it really is like with this, it's been shocking with our students that the number of larger parasites that they've been passing, and even myself, like learning about all of this and then getting prescriptions and treating. It's like it's really shocking how many parasites we carry, especially when we don't feel well.
Yeah.
Or maybe our gut is like, for me, I don't have multiple sclerosis, but I still knew that my gut was not 100%. And I'm in Canada, and it's really hard to treat parasites in Canada because you go to your doctor, you get a stool test done. Nope, you don't have any parasites. Have you traveled out of the country? No. Well, then if you haven't traveled, you don't have parasites. And it's like, well, why do my pets get parasites? And well, and they're in the soil, they're on our produce. If you're vegetarian, that doesn't
Yeah.
mean you're not exposed to parasites. They're just part
That's
of life.
yeah, and I
They're
wanted to, oh, go ahead. I was going to ask, what are some of the most common ways that you see parasites enter the body?
Well, I think that the overuse of antibiotics is
Hmm.
really the biggest factor that disrupts our microbiome. So
Hmm.
there's a time and a place that we need to use antibiotics. But for myself, I was on a lot of antibiotics as a child.
Hmm.
We were from the generation like, oh my gosh, every time you have a fever, you've got to use antibiotics because you could get strep and it could hurt your heart. So my mom was really worried and would just beg the doctors. Well, the doctors would say that, right? And so we were on a lot of antibiotics. I was on antibiotics, tetracycline for months for acne. And I think that really, that's been something that we've seen across the board, that people that have a history of, several times of using antibiotics, it just makes us more susceptible to the parasites that we're exposed to.
Hmm.
And so you can't avoid parasites. They're all around us. If your ecosystem inside of you is really strong, it's going to and your immune system too, right? So if we do have a malaria babesia type protist or even Borrelia, the parasites can suppress your immune system. So if you your lymphocytes are usually low with chronic malaria, and so and we don't even talk about malaria because we don't think that we have it in our countries, but we do. I did travel to Africa, but this was when I was quite young, like a young adult, and I never made the connection. But
Hmm.
we have lots of people in Canada that have multiple sclerosis that haven't traveled to a
Of
country where
course,
they
yeah.
have a lot of malaria. So, but if you
Hmm.
look, you'll see that your government will say that there's malaria cases every year in your country and in our country. And so it's just stuff that's been ignored. And I just asked the question, why? When we grew up on a farm, like the doctors would regularly, or I don't know, maybe once a year, treat us probably for roundworm. And it might have been Combantrin, which is parental palmate, which you can get over the counter in Canada. Mebendazole is something else in some countries. It's just, they're safe, they're easy for kids. But I was exposed to a lot of parasites because we
Hmm.
had every animal on the farm, and I was out in
Yeah.
the dirt all the time. And I had dysbiosis as a young child. I knew I had stomach aches and constipation, and then it just progressed, going from that to having multiple sclerosis.
Hmm.
So we've had the amazing privilege to coach like thousands of people all over the world. We have amazing recoveries from, MS, but other conditions too. Most recently, one of the nurses, we've had a ton of nurses take our program. We have an MD taking our program right now, pharmacists, veterinarians, which you would think that they would know how to treat parasites because they
Hmm.
do that in animals all the time. And it's very humbling and it's a huge honor for me to support healthcare professionals, because every time one of them learns this skill and recovers, then they really understand their patients a lot better, right? There's nothing like on the job training of
Hmm.
recovering from a parasitic infestation yourself to really know, like, oh my gosh, we had no idea until, like, I have hundreds and hundreds of pictures of what our students are passing, and they're quite challenging to treat if you have let them get out of control, because like a roundworm can lay 200,000 eggs in a day, and they have larvae, they hide under biofilms. And so you have to do multiple cycles of treatment, but with each treatment, you're just feeling better and better. And then you can never sterilize yourself from these parasites, but you can knock them back far enough that you have, like myself, I've been able to live an amazing life for 35 years,
Hmm.
and I'm sure that it'll carry on. So it's about restoring enough balance to have amazing quality of life, learning how to manage the microbes that live in you. And that's
Hmm.
really, I think, a missing link in healthcare right now. We're talking a lot about, heavy metal detox and um, all kinds of other things that, mitochondrial dysfunction. And it's like, well, why is there mitochondria dysfunctioning? It's like, could it be that the microbiome is off? And even the genetic testing and all of this, like, people can spend $100,000 to $300,000 on their health and they're still sick because
Hmm.
their microbiome issue has not been addressed. And it's no fault of the practitioners. It's just that they don't have good tests.
Yeah.
They've never been trained to identify, to look, to know what the symptoms are. They haven't seen them.
Hmm.
And it's so sad that our students can literally take some of the worms that they've passed, and I've heard this many times, they put them in the stool sample that's supposed to get tested, and it's just not even looked at. And they go, nope,
Really.
didn't find anything. I've
Hmm.
heard this many times, and I don't know if it's just the procedure that they just, throw the stool into like something that emulsifies it and they just take a small sample, or they don't look. I don't know. I don't understand, but it's
Hmm.
really frustrating for our students.
Well, with the amount of success that you're getting and the mounting research and anecdotal improvements that your students are seeing, why do you think there's so much resistance from kind of your mainstream approach to MS?
Well, all you have to do is look on the last 2 pages of the McDonald 2017 criteria, and you'll see that it's heavily funded by the drug companies that are selling the disease-modifying immunosuppressive drugs. So these drugs are really expensive. The newer
Hmm.
ones, like, I won't say the names of them, but they literally are like over $100,000 a year per drug. We have like multi-trillion-dollar healthcare industry right now, and like what would be my absolute joy is if you could go to your doctor and say, doc, I've been waking up through the night, I'm just not sleeping well, having insomnia, feeling tired during the day, dealing with some rashes, like some brain fog, and little things like that. If your doctor could go, oh my gosh, it sounds like your microbiome's out of balance, let's see if we can figure out which parasites you're dealing with.
Hmm.
Maybe it's just a little bit of roundworms, or maybe, the problem is we'll treat bacteria and fungi, but we're not treating the worms. And those worms, they will infect us with their own microbes. So Dr. Alan McDonald found those small filarial worms in the central nervous system were loaded with Borrelia, which is the bacteria that causes Lyme disease. So
Hmm.
they're living in us, they're eating our food, they do absorb a lot of metals, which is good, but they're infecting us with their parasites too, right? The bacteria, et cetera, that are coming out of them. So going back to your question, like, why are we not looking at all this research, is that it would disrupt our healthcare system
Hmm.
so much, because your doctor could correct your microbiome early on, and then you would never develop chronic disease. And that is the problem, is you wouldn't need all of these immunosuppressive drugs. So right now, our healthcare system, I believe, is kind of hijacked. And I'm not against pharmaceuticals. We need certain treatments in a crisis intervention, like certain drugs are really helpful. The medical system is really great at, any crisis intervention, but we're not treating the cause anymore. And we're out of balance in our healthcare system. So look at the last 2 pages of the 2017 McDonald criteria, and you'll see, and that is to me, it's a huge conflict of interest. It's like the people that are selling the products should not be influencing how the products are sold, right?
Hmm.
Especially when it comes to healthcare. They should be completely separated from that. So, and then this links to, the MS Society has been heavily funded by these companies that are selling the disease modifying drugs. And it looks like most of the research that's even going on, it's like they're they're like, wow, there's so much evidence that MS is a vascular disease. We should really call this a new subtype of multiple sclerosis, vascular MS. We don't know the percentage. Maybe it's 100%, maybe it's 50% of people that have MS are dealing with vascular issues. Obviously, we have lesions in the central nervous system, and we do know that there are other parasites that do cause lesions in the central nervous system. This is all documented in science. I've done a live event on it. So this is where our research will continue. It's like, is it always a malaria babesia? That's one of the factors. Like, our students are passing a lot of roundworms. Intestinal flukes are like something that's really overlooked. They cause a lot of inflammation in the central nervous system, or in the body and in the central nervous system. Tapeworms again, and the larva, like sometimes it's the immature form that can cause more of the problem than actually the adult, because they're moving into the central nervous system and causing a lot of damage there. And then the filarial worms. So it's not just the malaria babesia, but if you treat the larger worms and you don't treat the babesia malaria that is suppressing your lymphocytes, then you will be more susceptible again to more parasites. So it's not just your microbiome being out of balance, but it's also the state of your immune system if it's able to deal with the parasite. So I don't know what the answer is. The problem is we have healthcare professionals that are recovering from multiple sclerosis. And I know in Canada, we just had one, and she's like, I want to work with you so badly. I want, like, what we'd love to do is create a continuing education program, just a short educational course for practitioners, and, train them in this. And she's like, or even for her to support our students. And she says, I cannot work with you because I'll lose my license, and we can't get this course okayed by the College of Physicians, probably because I don't know if you, like, just with what we've gone through over the last couple of years, just even some of the different treatments that were, really helpful for treating this thing that we were dealing with as a society was not allowed. So, like, all I can do is speak on podcasts and talk and share the truth. We do have a practitioner members area that we give to our practitioners for free. Just the rationale, what treatments seem to help. I mean, I wish I had more time to put more information in there, but it's a start. But, like, we have healthcare professionals that would really love to train up other healthcare professionals in this, but it's literally being suppressed. And it's such a shame because people are losing their health, they're losing their quality of life, they're dying prematurely, they're suffering terribly. Like, multiple sclerosis is a brutal disease, but so is ALS and Parkinson's and PLS and Alzheimer's, and cancer, and they're all infectious diseases. They're all caused by the biggest factor is, like, certain microbes. I did a live event on cancer and parasites, and there is such a history of, them knowing, not our doctors, but in science, that so many of the parasite drugs, they cure different types of cancers. And so now I think that maybe they might start repurposing some, because they can't keep this in a box forever. They can't, because the information is getting out. The general public is becoming really interested in parasites. The problem is they don't have the direction that they need. So, like, they're trying different herbs, and they're spending a fortune on supplements and herbs, and they might pass a worm or two, but they still have most of their disease and symptoms, because our students usually test well for 3 to 5 parasite drugs at one time. So, if you take one parasite drug and you're going on forums and you're learning about this one parasite drug and you're taking a suboptimal dose, I don't recommend it, because you can make these parasites resistant to the treatments, and then they'll never work for you, and you could hurt yourself. Like, you really need to be guided through this. And once you learn the skill, then you can play a really active role in it, especially with your healthcare professional. And it's just the game changer of what people are searching for. This is the missing link.
Yeah, that's amazing. So you obviously had a great response in your recovery. You've mentioned cancer, ALS, Parkinson's, Alzheimer's. Are those things that you're also seeing reversals of or improvements in by
Oh,
taking this approach?
absolutely. And it's not something that I've come up with, it's that I've
Hmm.
scoured the research. So
Hmm.
there's huge evidence that Parkinson's and ALS and PLS, that there's disruptions in their microbiome. There's actually one older doctor that treated with multiple antibiotics and had a 60% recovery from his ALS, and years later he was still living. But there's Parkinson's there. If you just do Google searches or go to PubMed and just type in Parkinson's and um, just dysbiosis or Parkinson's and microbiota or microbiome, you'll see that there are lots of studies showing that, just like with multiple sclerosis, that our microbiome is off. But
Hmm.
they're looking more at bacteria and viruses, and they're not really looking at the other parasites yet. And I don't know why, but they're not. So
And you mentioned that one of the big ways there's not really a great way to test for specific parasites. So it sounds like you're leaning heavily on the energy medicine, the energy testing, through a variety of different methods, including muscle testing. And I think there's a lot of value in energy medicine and testing, and muscle testing. I've had a number of applied kinesiologists on the podcast to talk about what they do. I think one of the biggest maybe negatives or maybe things to think about with muscle testing is inter-examiner reliability, right? So is somebody able to test consistently for the right type of protozoa or parasite? So I guess my question to you is, how important is getting that accurate diagnosis of the correct bug essentially to the patient's recovery? Or is it kind of you identify there is parasite activity going on, you can get pretty close to seeing improvements if you're like kind of like horseshoes.
it's kind of like a confirmation more than
Hmm.
anything.
Okay.
But there have been times where the energy testing is way off, and like
Hmm.
you look at their symptoms, you look at their diagnosis and everything else, and if it's like you don't have parasite, like we've heard almost everything, right? And there's ways to decrease the bias too. So our students always will take like one dose of a parasite drug and put it in a baggie and label it number one, so that
Hmm.
the practitioner shouldn't care what they're testing. They should not know what they're testing. They should just be going yes, no, right? And that's one way to decrease a little bit of bias. But we really use the 5 criteria right now to be able to determine where to start. And generally, like we always start from treating large parasites first, because if they're going to keep infecting you with smaller parasites, then you don't start with a small parasite. So
Hmm.
you start with larger ones. Most people have roundworms. And then also, like with the oxidizing agent that we use, we can do enemas with it. And so very often our students are passing very large worms and they're documenting them. Like I get them to like to lay them out on tin foil or parchment paper so they don't rip apart, and put a measuring device beside it. And so from that, you can sometimes tell. It's a little bit hard to know if it's a tapeworm or a roundworm, but very often you can kind of tell that intestinal flukes are wider, or flukes will be wider and shorter. So that's another helpful thing. And also, I always say it's really good evidence to document what you're passing for the practitioner, because if you're in a country like Canada, where maybe a naturopath can write prescriptions, but their college doesn't really want them to treat parasites, then they need to build a case for you. They need to say, okay, these are their symptoms. They've got all these symptoms of parasites. This is what they're passing, right? So it just helps to protect their license more too. So there are some students in certain countries that they cannot find an energy tester, because we've worked in like over 20 countries with supporting students. So then they will usually start with some common parasite drugs that we know are well tolerated. And also the prep work is really important. having, your patient or having a student feeling better before they start treating. If the parasites are super active, there's a lot of toxicity, they're not
Mhm.
eliminating well, and you just start hammering away at the parasites, they end up on a couch, they just feel terrible. But if
Mhm.
you help them to feel so much better, and it is absolutely shocking the symptom improvements that people can have when they get their carbs low enough, when they follow the Live Disease-Free diet well enough. We have that free on our website on livediseasefree.com. Under research, you can find the Live Disease-Free diet guidelines. And basically, it's getting the total grams of carbs down to between 30 to 40 total grams of carbs per day. That's the sweet spot where we notice the biggest improvements. And it can be like one of the first things is bladder function improves. A lot of our students have a lot of bladder issues, which is all linked with the infections too. So they're not getting up as often through the night. Instead of 5 or 6 times, they might get up once or twice. They're sleeping a lot better, which helps their immune system right there.
Mhm.
We notice reductions in pain. We can notice huge improvements in spasticity, all kind like cognitive function, like all of that improves with diet and
Mhm.
getting the bowels moving and just maybe using a binder. So just some simple things. Um, and then from there on, then once they're ready to get tested, then they will do that. But the prep phase is super important.
Yeah.
So with respect to your question, like how do we, like know, like
Mhm.
usually roundworms is where we start with
Mhm.
the larger parasites. And then if they're, let's say if they can't be energy tested and they've passed some, but they still have symptoms, then they might use some treatments that are helpful for flatworms and tapeworms. And then, and we pay attention to symptom improvements too. So there have to be updates like, have you noticed any changes? Have you not? If they don't do a prep phase successfully, the parasite drugs don't work as well. We've
Mhm.
just seen that over and over again. I wish there was a magic pill cure that we could take, but it just doesn't work like that with these
Yeah.
critters. And so that all helps. So
Yeah.
it might be down the road that, with a doctor that they might, with years of experience that we might have, that we just
Yeah.
kind of use a general protocol of using these 3 or 5 parasite drugs to kind of
Mhm.
cover all angles. These drugs are really old. They've been around for decades. They've been, for the large part, most like children, like thousands of children have used them. They're very safe if you use
Mhm.
them properly. And we're using them for like 14 days at the most and then stopping, like we're hitting in cycles.
Mhm.
So it's not like the disease modifying immunosuppressive drugs where we're really decreasing the B cells and T cells and making their immune system weaker. This is literally just hit the parasite drug, take a break. Sorry, hit the parasite, take a break, hit the parasite, take a break until you are symptom free, until you are,
Mhm.
feeling much better than you have in many, many years. So
Yeah. So it sounds like the testing is still kind of up in the air. Could definitely, hopefully, we have better testing and more specific testing so that we can be more specific with the intervention. But until then, it definitely sounds like there's certainly a method in place. So it's very intentional, which is great. And it sounds like you mentioned using a combination of diet, medication, and herbs. And it sounds like medication is kind of where it starts when it comes to the parasite, killing off the parasites. And you can correct me if I misinterpreted that. With that, you mentioned also that you are working with students in 20 different countries. Do these students typically have to find a medical doctor to convince them to prescribe these medications? Are these typically stuff that people can get over the counter? How are they actually obtaining these medications?
So it really depends on the country. So like in the United States, a lot of people can order through online pharmacies. They're pharmaceutical grade, they're generic, so they're cheaper. In Canada, it's a little tougher, so then you need more practitioners. I have worked with medical doctors and I'm very close with certain pharmacists. So our students have been using these treatments for years. It's kind of like deworming your dog or your horse or your cat. They're very safe drugs if they're used properly. But but people have to work with someone, right? I love it when they can find practitioners that will write, but I should say too, like that's in the United States, they might have their practitioner supporting them and working with them, but if they went to a local pharmacist, it might cost $10,000 for one treatment. Whereas if you order them generic through an online pharmacy, it's like $75. It's like ridiculous. These are like old, but our pharmacies aren't carrying them. They bring them in, and then it's like generic versus. So like also it's really helpful to find a compounding pharmacy. So in Canada, we have a compounding pharmacy. And so we can get all of the treatments at a much reduced price too. And so this is something that, people have to know too, that there's huge discrepancies in the cost for these drugs. So every country is different and individual. And, for Canada and Australia, it's been really tough, but we're starting to see, it's really shocking, like it's awesome, but we're starting to see neurologists even that are more open to like my students will go and talk to them and they'll share a lot of the evidence and say, what do you think about me treating parasites? And he'll say, well, I can't help you, but I think you should explore that avenue. So a really good doctor, as long as they feel that it's safe and it's not going to hurt their patient, and they don't really have options that will give them the quality of life that they want, that they're open. And that's a huge change from 10 years ago when we started. It was very closed, but we didn't have the huge amount of evidence and the general public interest that we have today. So, and then also like some of our students, let's say in Australia or New Zealand, like they couldn't find practitioners, but if you search hard enough, very often you'll find even a GP that is like, well, I don't know much about this, but as long as it's safe, I'll support you, and they'll write prescriptions. And so then look for a compounding pharmacy, or if you can so there are some over the counter, right? In every country, there's at least one over the counter. It's usually for a roundworm. And that would be like pyrantel palmate, which is Combantrin in Canada. And then also in some countries, it's mebendazole. But just taking that on its own, you're not going to cure disease. Like they're really, really hardy, especially if you have a neurological disease. We know that the parasites are in the central nervous system, and like mebendazole or pyrantel palmate, they'll only work in the gut, right? They're not going to work systemically. So then I can list some of the common parasite drugs. So there's albendazole, which is really helpful for a lot of people. Again, this is not telling anyone what they should use or not. It really depends on what you energy test well for. But albendazole crosses the blood-brain barrier. It's really tolerated well. Before the students are starting to treat, they definitely have a comprehensive panel done. They want to check liver and kidney function, because very often the parasites will live in the liver gallbladder meridian, and they could have elevated liver enzymes. And we have just found that just milk thistle, just taking that for a few weeks really helps to help the liver enzymes to return to normal, and then they will treat. And then their liver enzymes may become a little more elevated. This is a very small percentage of the population, and then over a couple of courses, like keep supporting the liver when you stop treating, and then after a while, it's gone. So that's the problem, is that a lot of these parasites will move into the liver area. And so with that, albendazole and then ivermectin has been really helpful. The combination of ivermectin and albendazole together is a synergistic effect, so it's a better killing effect. And then Alinea, which is nitazoxanide. So nitazoxanide is the actual drug, like the active ingredient, and Alinea would be more expensive. It would be a brand name. So nitazoxanide is awesome. A lot of practitioners really like nitazoxanide because it's very broad spectrum. It will be helpful. So this is where, like if you're using one treatment, if you're combining it with another one, then it's a better killing effect, because just taking one parasite drug, it does not eradicate all the parasites, unfortunately. So like nitazoxanide is like, a little bit for protists and tapeworms and roundworms, and also antifungal. So it has a broader spectrum of helpfulness. And then praziquantel has been really helpful also, and that one, it will treat more of the tapeworms and the flukes. It is like a detergent, and it will scrub the surface area of the worms. I'm just saying it in really layman term here. But that, like, the parasites have a way of making themselves blind to our immune system. Like, you might wonder, like, why is my immune system not getting rid of these worms, right? So they
Right.
have many ways to evade the immune system, to avoid it. And so the praziquantel, it definitely is helpful for the flatworms, but it also will help treat the roundworms. And praziquantel and albendazole, they do cross the blood-brain barrier. So that is helpful for treating the parasites that have entered the central nervous system. But this is where, if you, especially if you're prone to seizures, you really need to be working with a practitioner, especially because some of the practitioners recommend like 1 dose of dexamethasone on day 3 of treatment, because if you're prone to seizures, if you have parasites in a certain location, they want to avoid a fatal Herxheimer reaction in the brain, right? Our students have never had any issues. Like, they
Mm-hmm.
work very carefully and systematically with their practitioners, and yeah, so that's fine. And then pyrantel palmate is kind of helpful. So, having that in combination with praziquantel, it seems to be more helpful.
Mm-hmm.
And again, the intestinal flukes are something that is quite shocking, that it's something that is so overlooked. Even like in our lakes, so I'm in British Columbia, and we have these beautiful lakes, and if you swim in certain areas, they call it swimmer's itch, right? And so you don't know what that is. You think it's a bacterial infection, and looking more into it, it's schistosomiasis. It's like the blood fluke, and technically your immune system is supposed to deal with all of them. If you get, like, my son got a huge awful rash of swimmer's itch 1 year, but you know that it depends on the state of your immune system if they all get back past, if your immune system deals with them or not. And
Mm-hmm.
if it doesn't, then you might have a slow growing chronic infection over years, and depending on your lifestyle, on your diet, on your stress level, on your sleep, right? This is all what helps to bring us to the state of disease. And then, if you have one parasite, then that is going to be, suppressing your immune system or work for immune system, and then you're more susceptible to other things or what they're infecting you with. I think with flukes, Ehrlichia is one that we become co-infected with, probably from the fluke. So I don't think I'll ever finish researching, but
Yeah.
we've really come a long way with what we've learned, and it's incredibly life-changing for people.
Mm-hmm.
Even just the diet, even just decreasing the carbs. We have
Yeah.
people that listen to my live events, they just start lowering their carbs, and they're like, I can lift my leg up and I can walk up the stairs again. I can start writing again. Like,
Mm.
it's just shocking. And the
Yeah.
parasites are still there. They need to be treated,
Mm-hmm.
but they're more quiet, right? And there's a little relief for the immune system. It's not having to work as hard. So
Two-part follow-up question. Number one, how do herbs tend to stack up against the medication? And number two, are there instances where patients really have a hard time with the medication and need to defer to herbs?
we started with herbs before we
Mm-hmm.
knew about all the different parasite medications. And so if somebody has been newly diagnosed with a neurological disease like MS, and they follow all the steps and they use herbs, we have had people that have gone into remission with just herbs alone, but they're still carrying that burden of larger parasites. And, there's the risk of having, maybe not full on MS, but still struggling with symptoms. So we have found that it has not been possible to get the quality or the level of health that we want with just herbs alone. We
Mm.
wish we could,
Yeah.
but we have not been able to do that. And I really observe a lot of students. So there are different parasite like lines of supplements that you can get from different practitioners and different, companies. And, some people are spending like hundreds of dollars a month, and they still have their disease. So
Mm-hmm.
at this time, so things like black walnut and cloves and wormwood, those are kind of like standard helpful
Mm-hmm.
parasite treatments. There are other things too that are really helpful, but we have not found, and we even have a really great recipe on our website. You can even look it up, Brenda's Deworming. She puts it out there, and it's you can buy your own bulk herbs and mix it together, and it's a good recipe. But students might pass a few worms, but they still have their multiple sclerosis. And
Mhm.
it isn't until you bring in the parasite drugs, they're definitely more helpful. Are the parasite drugs the end all be all cure? No. The prep phase is super important. It's getting the body ready to treat, feeling a lot better, making sure that detox pathways are open, and as simple as like having daily bowel movements and using a binder. So we keep it quite simple. We don't recommend a ton of supplements because many of the supplements will feed the parasites. So
Mhm.
Borrelia loves vitamin D, loves the B vitamins, high iron. So like if somebody's anemic, they definitely need to build up their iron, but we don't recommend high doses of iron. It's literally just a multivitamin mineral from plants, maybe a little bit of extra calcium because our food
Mhm.
is so deficient, some vitamin D3 if you're not getting enough sunshine, and that's about it for supplements.
Okay.
And that usually saves people a lot of money, and it really doesn't make a big difference in their recovery. If people are taking a supplement that does not have ingredients that would feed the infections and it's helping them, we say carry on with it. But most people are like, I'm taking 10 supplements and I really don't know if it's helping. I haven't noticed any difference. And then we just say, it's up to you, but I personally wouldn't take them if you're not noticing a difference.
Okay.
So,
Okay. I have two more questions that
sure.
I can think of right now. Do you have time to answer them? I
Yeah,
know
for
we've
sure.
gone.
Yeah.
Okay. Uh, okay. So question number one is, say somebody is not experiencing any obvious symptoms, but they want to be proactive, right? An ounce of prevention is worth a pound of cure. And you're on the other side of it, so maybe you're doing these things regularly. But what would you recommend for people who are not struggling with maybe obvious neurological conditions to stay on top of parasitic infestation?
Number one is diet. So they love carbohydrates. So it's fine to have complex carbohydrates, to have some fruit, but the cleaner your diet is, you're going to discourage them. If you have a lot of processed carbs, that will really encourage their growth in your body. So that's number one. And I think that, having probiotics, we really like raw sauerkraut. That seems to be, especially if it's homemade, where it's a natural wild ferment where you're allowing the diversity to multiply to ferment the vegetables. So just really paying attention to your symptoms too. Like if you notice that you're there's nothing that's changed in your diet, but you're just more tired. And we know the parasites are really active at night. If you're having a hard time sleeping or waking up through the night, if you notice that during a full moon, you're having like wild dreams, and that if you're dealing with brain fog, if you're having, rashes, just those kind of general things is kind of a sign that your microbiome is out of balance enough that you should do something about it. If you don't have chronic disease, you could just start with herbs. Absolutely. You can use antimicrobial herbs, and they're in the health food stores. You don't have to spend hundreds of dollars a month. You will probably pass some worms. But if that isn't enough, then definitely look into doing at least once a year or twice a year, depending on your exposure to parasites also. So if you have dogs in your house or other pets in your house, um, you really have to use hygiene. I don't recommend having dogs in your bed. Just things like that, just being aware, washing your hands. But if you're around a lot of animals, I would personally, for sure treat once a year.
Mm.
And that can be over the counter. You could start with that and then learn about that oxygen therapy. Oh, and I wanted to mention too, like when you mentioned, like we use herbs and parasite drugs, but the oxygen therapy is just incredibly helpful. So we really like ozone, and we
Mhm.
started with ozone, but this other oxygen therapy is so incredibly cheap, and it's so easy to use, and it's so safe. It's been so heavily censored, so we're not going to talk about it here. But again, you can find it on Live Disease Free, and just do a search for treating parasites with oxygen. So to do those enemas, like let's say if you're using herbs and you do the enemas, maybe once or twice a year, they're not habit forming. They're not going to hurt you. And they really do. If there's any larger parasites or small ones in your large intestine, you can reach them with that enema. and they come out. And then you can kind of monitor, like, am I passing things or am I not passing things? And that really helps you. A lot of the parasites do live in the small intestine, but they do make their way down to the large. So if you're doing an enema with this oxidizing agent, then you will see them coming out. And we don't recommend coffee enemas just because this oxidizing agent, it does everything that a coffee enema does, but it will also kill any parasites that are in that area, which is so much more helpful. And parasites are stimulated by caffeine also. So we don't have any caffeine products that we're having: chocolate, coffee, caffeinated tea, or even decaffeinated, because there's still a small amount of caffeine in those in decaffeinated products. So when we're wanting to recover, we want to make those parasites quiet. So we're really avoiding anything that would stimulate them. So
Okay. Yeah, really, really good tips there. My final question slash request, I guess, is would you be able to kind of summarize what someone with MS might expect? You know, you mentioned the prep phase, then there's the medications. What are the kind of big picture steps that somebody would expect if they're to go through kind of this program or this thought process?
awesome. So I'll summarize it here, but I have a masterclass training that people can listen to where I talk about all the steps in more detail, and I give a lot of case studies and all the like different common types of parasites that are involved with MS that we see at this time with the research. There's like lots of evidence on all of that. So that's the masterclass training on our website. So number one is the diet, getting your carbs low enough. And within like a week to 2 weeks, you should start to notice significant symptom improvements if your carbs are low enough. Number two is to support the body. So this is where we look at your blood work and we support areas that need support. We decrease, make sure you don't have any mold in your environment. We decrease the wireless radiation you're exposed to, because we know that the parasites are much more virulent with high wireless radiation around us. So there's ways we can work with technology, but we can decrease our exposure. So we clean up the environment, especially of mold and decreasing wireless radiation. And then making sure we're having daily bowel movements. So that's really important before we start treating, because once we kill these parasites, we want to be eliminating them daily. And we want to make sure that we're sleeping 8 hours per night. So sometimes we have to use over-the-counter supplements to help us to sleep and also to help us to have daily bowel movements. So once we've got those things, that we've done the prep phase and we're feeling a lot better already, then our students will start to use the oxidizing agent orally, and they will use herbs orally as they are getting access with practitioners to like samples for energy testing, getting energy tested, and then getting prescriptions. And then once they have the list of the treatments that they test well for, because the practitioners at this time don't really know a lot about the parasite drugs, so we help them to build a game plan. So we're like, okay, so you test well for this, this, and this drug, so this is how you would introduce it. These are the recommended dosages. And this is not anything that I've come up with. You can find this on pdr.net. You can, like, on the pharmaceutical websites and, you know, pharmacies, because if the pharmacies are filling out these prescriptions, then they're not going to go against what is safe, right? And so we help to build the plan. And then, of course, if they're working with a practitioner, it's like they double check and they go, yeah, that looks good. And then they start treating. And they will introduce, let's say if they test well for 3 parasite drugs, they will start with 1 and start with once a day. Okay, I tolerate that. Twice a day. Yeah, that's good. Okay, now introduce the second one, once a day, twice a day, etc. And so they're building up so that they're taking the 3 that they test well for. If they tested well for 5, then they might start with, you know, 3 for 14 days and then the last 2 for 14 days. And then if they tolerated that really well, then the next treatment cycle, then they'll be able to combine all 5 parasite drugs together. So there's a much greater killing effect with using a combination of parasite drugs. And you might think, taking 5 parasite drugs at one time, is that okay? It's like, yeah, the less parasites you have, like, you wouldn't even notice that you're taking them. And so that's why we can't expect them to be a magic cure either.
Right.
So we're taking doses that are safe and that are helpful, but they're not going to completely kill the parasites. And so something that another insight that I've gained is because myself, like I tested well for five parasite drugs. And so I could take them because I don't have MS and I don't get a Herx reaction, a die-off reaction, et cetera. But so I didn't do any of the enemas for like 7 days because I wanted to see, like, surely if you take 5 doses or 5 parasite drugs for 2 or 3 times a day, after a full week, if I do an enema, I shouldn't notice any worms, right? And so like on the 7th day, did the enema, and sure enough, the worms came out. And so it's like, okay, so it's not a complete eradication. It's helpful. It's more helpful than just the herbs alone. But things like wormwood are really helpful also for, the malaria, babesia, Borrelia. We like the liposomal herbs for treating. There's some really good blends for treating Lyme disease. I just haven't seen a lot of success in people that have used ongoing antibiotics for treating chronic Lyme.
Yeah.
But the herbs, and also a lot of people that have come to us that don't have MS, but maybe they have been working with Lyme literate doctors, and they start treating the larger parasites first, and they're like passing 2-foot worms. And they're like, finally, for the first time, I'm starting to feel better. And so very often you could have a DNA test for Borrelia and it could show you have Borrelia, but is that what's causing your biggest symptoms, or is it another parasite that's causing your biggest symptoms? So the people that have, Lyme disease, they usually will have many other larger worms. And if you don't treat those first, then you will never really recover from Borrelia. And my sister, like years ago, DNA Connections, when they first came out with their first DNA test, like it showed that she has Borrelia and Bartonella in her test result, but she has no symptoms. Like, she's symptom free. So that's the problem. Like, we can use the test as information, but it is that, are those critters, is there just DNA present? Is a small number present? Is that what's causing symptoms? And so this is a challenge. So
Yeah. Yeah. Well, so far you've presented really eye-opening information today, and I'm really excited for our listeners to get to hear you and explore what you guys are doing and hopefully help some people who are struggling. One final question, I guess, is how can people find out more about you, and how can they get involved?
So the first step is to go to our website, livediseasefree.com, and you can, right at the top there, you can put your name and email address. You'll get access to my masterclass training. Also, I have an amazing blog. Like, it's so incredibly educational. And I think that is why practitioners like yourself are reaching out to me, is that they're starting to see. And it's so neat because I have like one student that joined in Australia. She's like, my naturopath gave me the cheat sheet for your diet. So I do have the cheat sheet that practitioners can use to hand out for the diet. So our website has a lot of resources. I've got a lot of videos on YouTube and on Facebook. On Rumble, it's more like the condensed, edited version, and some topics that are sensitive for YouTube and Facebook that I can't talk about. But
Right.
if you go to our website, you'll see that is like, you can either scan my notes or you can listen to a shortened version of the video on specific topics. And it's incredibly educational. And it's not just for multiple sclerosis. And that's really important to know.
Yeah.
Is that when we have MS, PLS, ALS, Parkinson's, Alzheimer's, cancer, like, we are at the final stages of parasitic infestation. And for people that are not there, like, I have a lot of students that join and work with me. They're like, I'm having really scary neurological symptoms, and I'm really sure that I'm dealing with parasites. Some people have passed parasites and they know they have parasites, but they can't get help. And so for people like that, we help them through this systematic system of step by step, where they're playing an active role. They're doing a lot of the prep work. They're getting ready. And they have to, in a respectful manner, direct their practitioner, and their practitioner is really open if they know it's safe. And so in order to recover, they have to play an active role. And so they avoid diagnoses because they're able to nip it in the bud before they get the disease label. And that's really where we want to help people, because it takes longer. It's more work when you are more infested, when you've had more damage to nerves. But I wanted to mention one really exciting thing is that, we thought that when people are in wheelchairs, that that's it. They can never, ever come out of wheelchairs. But we have had a number of people come out of not needing scooters anymore, not using wheelchairs anymore. Like people that haven't walked for many years, walking
Mhm.
again, obviously not walking right at the start. They might use crutches. They're doing squats. They're back on their bike. But what we have discovered is that there is so much inflammation that is not permanent damage to the nerves. And inflammation can heal, but permanent scarring to nerves can't. But so much more is just still inflammation that people have. So they can have a lot more recovery than they ever thought possible. And that's really good news for people.
This is incredible. And again, that is livediseasefree.com is where you can find out more about this. And I want to thank you. I've taken up a lot of your time, and I really appreciate you sharing today, and I look forward to learning more from you as well in the
And
future.
I thank you so much, Dr. Joe, for helping us to get these truths out. It will be life changing for people.
Yeah, my pleasure. Well, everyone out there listening, be well.